Welcome to OET for you. So today we are going to discuss about OET writing, converting case notes into sentences and paragraphs. A step-by-step guide by OET for you. Okay, introduction. As you all know, in OET writing, case notes are written in shorthand form. Candidates must convert these notes into full professional sentences. So the goal is clarity, conciseness, and relevance. So this presentation will cover the step-by-step process. As we studied in the last class about how we can categorize the informations in a case note, so from that case note, you understand that case notes are brief and fragmented, often include abbreviations, symbols, and missing words. Need to be expanded into grammatically correct sentences. Maintain formal and professional tone. Okay, let's see what are the key steps for sentence construction. As we categorize the case notes, so from the case notes, you have to create a sentences. So for that sentences, always identify the main idea of the case note. So we know the main idea is very much related to the main purpose of the letter. And as well as use always full grammar structure. So you studied in previous classes in your preliminary when you started English. So the grammatical structure of a sentence include a subject, verb, and an object. So that makes it a complete structure of a sentence. So you have to write in that structure from these case notes. Okay, so maintain correct tense. We all studied past, present, or future tenses. So please refer back to the tenses you already studied in the previous classes. And using linking words gives you smooth flow between the sentences as well as the paragraphs. So always avoid word for word copying from case notes. Okay. For an example, see the case note, 45-year-old male, history of hypertension, presenting with chest pain for 3 hours. Refer to cardiology for further evaluation. So make it as a full sentence. Mr. Johnson, a 45-year-old patient with a history of hypertension, presented with chest pain lasting 3 hours. He has been referred to cardiology for further evaluation. Example 2, converting a little bit complex case note. So 60-year-old female, diagnosed with type 2 diabetes, developed a foot ulcer due to poor glycemic control, requires wound care and lifestyle modification. So create the sentence like the subject, that is the patient's name, Miss Adams, a 60-year-old patient with type 2 diabetes, developed a foot ulcer as a result of poor glycemic control. The information in the case notes is transformed into first sentences. Then again make it into second sentences. She requires wound care and lifestyle modifications to prevent complications. So expanding these sentences into paragraph is the next step. Combine related sentences smoothly using linking words. Example, therefore, as a result, additionally. So you can maintain that logical flow and background issue action required that we studied different paragraph structuring, prioritization, S-bar method and SOAP method, problem solving method or chronological methods in previous classes. Avoid unnecessary repetition. For an example paragraph, for Mr. Thompson, a 70-year-old patient with chronic arthritis, has been experiencing increased joint pain over the past month despite medication adherence. As a result, he has difficulty performing daily activities. A referral to a physiotherapist is requested for further assessment and management. This constitute, you can see the flow in that paragraph, and you can see the linking words and the logical flow, and there is no repetition in the whole paragraph itself. So avoid these common mistakes. Example, copying case notes word for word, writing fragmented or incomplete sentences, using informal language or abbreviations. So avoid including irrelevant or excessive information, and ignoring the purpose of the letter. See, if you ignore the purpose of the letter, so your score in writing will be drastically reduced. Okay, so this is the practice exercise. You can do it by yourself, and I will give you in the next slide a sample suggested answer as well. Okay, so the final tips for writing: so always expand case notes into complete professional sentences, ensure logical structure and paragraph flow, avoid repetition and unnecessary details, use linking words for coherence, keep the tone formal and medically appropriate. Conclusion. So converting the case notes into full sentences and paragraph is a key skill in OIT writing. Focus on clarity, conciseness and relevance. Practice regularly to improve your efficiency and accuracy. Always reread and recheck your work before submission. Thank you very much.